with perfect. Thank you. I'd like to start with gratitude to be here and with recognition that I'm joining you from the unceded territories on the homelands of the Coast Salish people. It's the Squamish, Tsleil-Waututh, and Musqueam nations where I'm joining you. And the work we do in British Columbia takes place on the ancestral lands and many unceded territories of 198 distinct First Nations. I'd like to also acknowledge that we have many partners who help BC NPHA deliver education events like this one. And this webinar comes to you today as part of a series. This is our 6th webinar on this topic. These have been in partnership with BC Housing and the City of Vancouver. We've hosted presentations with information on taking an equity-informed approach on building overheating and air quality as it relates to new construction, as well as on building retrofits, COVID-19, and general preparation for extreme heat. You can find all of these recordings for your reference on our website. And if we get a moment, we can also copy those links directly into our chat for your info. A quick outline for today's presentation. We are joined by Vancouver Coastal Health Medical Health Officer, Dr. Michael Schwant, who will provide a public health context to extreme heat, poor air quality, and mitigation strategies. And we'll answer some of your questions after presenting. Following that will be Luann Ruotsalainen, Executive Director at Decathlon Quesnel Community Housing Society. Patty Makahonic joins us from Ann Davis Transition Society as Executive Director. And Marty Jones is with us, who's the Director of Housing and Hiring Manager at Surrey Urban Mission Society. These nonprofit and service providers will share their experiences, their actions and lessons learned on extreme heat, followed by a short panel discussion. Once we do that, following this, we have BC Housing Sustainability and Resilience Director Magda Schwala will share with us some resources to help us prepare for the upcoming heating season, hot season rather. And we'll have time for your questions and aim to close by 2:30 or sooner. I'd like to welcome Dr. Michael Schwant to present. Thanks.
All right, thanks very much for the warm welcome, and to everyone attending today on this topic. I think there's a lot of opportunity for health protection during extreme heat events, during air quality events like wildfire smoke. I've spoken to many of you before on these topics. I'm really excited to be able to share some information that might be familiar, and hopefully some new information as well on how we can protect health for many people. I'm just going to share this presentation right now. So if you're able to, I suppose, give a thumbs up if you're able to see things, that would be a great help. Or else potentially let me know audibly if you can't hear it. I'm just going into presentation mode.
Yep, we can see it.
Lovely. Okay, so again, I just want to acknowledge my colleagues, Sarah Henderson at the BC CDC and Emily Peterson here at Vancouver Coastal Health, who have contributed a lot of the science around this kind of work in British Columbia. I live and work on the traditional territories of the Squamish, Musqueam, and Tsleil-Waututh peoples. Vancouver Coastal Health operates there, as well as on 11 other First Nations. I think that's really important to note when we think of reconciliation and public health, that some of the very risk factors for, in this case, illness due to extreme heat might, in fact, are felt differentially across populations, certainly more so, disproportionately so among Indigenous populations. That is, a result of policies of systemic racism in many cases. I think that's something that, I try to bring into my work within the Health Authority, and it's just something that I wanted to mention as we undertake this discussion today. So extreme heat, where are we in terms of what we expect with heat? By 2050 in Vancouver, the Pacific Climate Impacts Consortium has forecast that we're going to see twice as many days over 25 degrees Celsius as we had previously, as we had it basically up until now. And then in fact, days over 30 degrees, what we would call very hot days in Vancouver and the surrounding area, are going to occur 12 times more often. So these used to be quite rare in Vancouver, and we're expecting to see more and more of these hot and very hot days over time. The peaks of our heat waves are expected to be much warmer. Temperatures that used to be fairly rare, we're finding summer to summer even becoming more commonplace. I think some of us would reflect even in recent years. As well as that, with hotter and drier summers, we expect to see more wildfire smoke, more wildfires and more smoke related to that. All of you will know that temperature records were broken in June 2021 right across the province. We'll talk more about the heat dome and some of its deadly effects, but we saw in many of your communities, right across BC, these temperature records, numbers that almost don't even make sense. When you're looking at these as someone who's been in British Columbia for a little while, these are truly off the charts and becoming previously almost unthinkable or rare temperatures, something that we now expect to see potentially in any given year. Similarly for wildfire smoke, this is a graph looking at the very bad wildfire smoke seasons of 2017 and 2018 compared to what I call a normal year, 2016, and the darker graph there. This is a graph looking at particulate matter, so the most harmful to health of the particles in wildfire smoke. This was again just orders of magnitude above what we would see in a normal year, what people might be exposed to from traffic-related air pollution or other sources month to month. We see these massive increases during heavy wildfire seasons. And this comes with really tragic impacts. We saw in the heat dome last summer, at least, I should note, 595 people killed by extreme heat. Depending on the assessment, on the study, it's perhaps even more than that when we take a broader look at the potential deaths due to wildfire smoke. So we need to take into account these can be health emergencies, and as well as working to prevent ongoing climate change, we're now in a situation where adaptation and resilience to climate change are very important. Just why I'm so glad to see such a large group on the call today. In terms of what I'll try to discuss today, just give a bit more of an outline on how heat and wildfire smoke can affect our health, talk about some specific vulnerabilities to heat and smoke. Those can be both medical or physiological, but then also social and environmental, and then get into the topic of planning for extreme heat and wildfire smoke before handing over to some of our partners with organizations who have been doing a lot of work in that area. So we won't spend a whole lot of time talking through this scenario, but many of you might have seen this sort of thing last summer. When I developed this for a different presentation some time ago, this was a hypothetical scenario, pretty rarely seen. Now, almost all of us might have experienced that, this idea of extreme temperatures without cooling overnight, and the risk that people at higher risk, maybe due to older age or isolation, experiencing symptoms related to extreme heat. So in a situation like this, I hope that by the end of this presentation and the other guests who are here today, that we'll all be able to speak to some of the actions that we might take in such a situation, information that we might gather to try to help our community members who are experiencing extreme heat illness or trying to prevent that. You don't have to write down or type your ideas, but you might, if you choose to, that's fine. And we'll delve into that a little bit further. Just as a note, though, some of the things that we would definitely recommend with those symptoms that I described there, and we'll visit throughout the presentation, seeking emergency medical care promptly is very important. Heat stroke can be a medical emergency. It does move very quickly, particularly in people with medical vulnerabilities. And we do need to act quickly if someone's having severe symptoms. There are a number of steps that we can take right there in place if the symptoms are milder. Lowering body temperature, a cool shower or wet cloths can be very helpful. Making sure that the physical environment or clothes someone are wearing are optimal for cooling off is very helpful too. And then most of all, getting to a cooler space is really important. So we want to talk about ways to try to establish that in place within a given housing situation, and then also spaces that a person might access. I won't go into terrible detail about the recent impacts of heat in BC, but again, with that heat dome that I referred to, this is a more recent study from our BC CDC colleague Sarah Henderson, who I had mentioned, finding perhaps over 700 excess deaths in the province related to extreme heat, and this has been recognized as something that we really need to be prepared for going forward. Looking at this graph here, you'll see the little blue line there is just showing the temperatures day by day last summer in late June and early July. So you'll see a massive hump into the 30s, almost approaching 40 degrees in Vancouver. And then there's what we call excess mortality, so deaths above and beyond the norm happening right around then. So we saw that, particularly late, we saw right through this heat wave, but even in the later days, this is something that I think is very important for us to keep in mind, that cumulative burden of heat can put people at risk late in the heat wave, or even after the heat has come back down. We still see that continued mortality. This isn't necessarily evenly distributed across the population. We do know that people at advanced age might be at increased risk for death during heat events, or are, in fact. This is what this graph is showing. And also the people who are living in the community can be at increased risk. We saw that even though many people who have medical comorbidities or frailty related to older age in hospitals or in residential cares like long-term care homes, actually seem to be relatively protected because many of their risk factors are dealt with. There's frequent monitoring, there's maybe social connection, protective factors that can help mitigate those heat impacts. Oftentimes, people who are living in community might not have that same frequent check-ins or the presence of healthcare practitioners literally in their home. They can help with that. So that's on one hand a major risk factor. On the other hand, a major opportunity for preventive steps, and that's what brought all of us here together for. And when I mentioned that uneven distribution across the ages, it's also there's an uneven distribution across geography. This is just a heat map of the home addresses of people who attended the emergency rooms of Vancouver Coastal Health during the heat dome last summer, really showing concentrations of risk in downtown Vancouver, including the downtown east side, areas of southeast Vancouver as well. And when we look at some of the potential risk factors, including building types, the amount of green space, social or material deprivation that might be in place, this does cohere with what we know about risk for extreme heat. And I think that it does tell us we need to focus where we put some of our efforts. Universal messaging is important during heat waves, but also focusing on people who are placed at the greatest risk. This is from BC CDC research. Some of the main themes that they found in terms of risk factors included, as I mentioned, social or material deprivation, social isolation, mental illness and substance use can put people at risk as well. And then comorbid diseases, most particularly diabetes, seem to be a risk factor. On the flip side of that, privilege, in short, the ability to either through purchasing or through access, getting to cooler spaces to cool off. That could be air conditioning, that could be a place to go that's cool, does seem to be protective during heat events. Green space, both being able to go to it to cool off, and then its cooling effects on neighborhoods does seem to be protective. And then being in care, as I had mentioned, people who are in a long-term care home, people who are in residential care, did seem to have, through a number of mechanisms, some protection during the heat wave last summer. Very common question we receive: what are the symptoms of heat exhaustion or more severe heat stroke? And I won't go through each and every one of these. I've put a reference there to our VCH webpage, vch.ca/heat. I'll share some resources at the end of the presentation. But these are some of the main symptoms that we can see. Important to keep in mind that these symptoms on the left side of the screen can happen relatively early. And as I said, these symptoms can progress quite quickly. So in these early symptoms, trying to get to a cooler space, trying to give somebody water and hydration and cool them off overall can be very important to stop from moving into these symptoms of heat stroke. When we see an actual elevated body temperature, neurological symptoms like confusion, lowered state of consciousness, lack of coordination, all of those symptoms really tell us that somebody is not compensating for the extreme heat. These mechanisms of thirst and so forth are no longer working, and we do need to seek medical help at that point. Not just heat, wildfire smoke are summer concerns in terms of climate events. We know that these can cause respiratory issues. People describe having shortness of breath, cough, even chest pain during those times, and it can cause an increased risk of some infections as well. So pneumonia, COVID-19, there's evidence around that. And as well as that short-term effects that we've, some of us may have even felt during or experienced during wildfire events, there's more research that these can have long-lasting effects. Heart disease is one of those things that may actually be contributed to by exposure to wildfire smoke over a single season or even season after season. There's a lot of data. Again, you'll see some of this BC CDC data on the left side, looking at estimates of how many mortalities we've seen within Metro Vancouver on this due to this health hazard. Why is it such a hazard? Fine particulate matter, or what we call PM 2.5, is really the main driver of the morbidity and mortality related to wildfire smoke. And this is, these are complex particles. They often contain a number of different chemicals. And as this figure shows, compared to a human hair, these are tiny particles. They're 2.5 microns in size. So if you look at that that small pink ball within a blue ball within the human hair there, you can see that these are so small, and for that reason, they're able to get into the very smallest of our airways, through the trachea, through the bronchi, and right into the lungs, and even crossing over into the bloodstream, where they can cause inflammation and a number of severe impacts. And this is really the thing that we measure and try to understand most closely in terms of risks to health, present to a large extent in wildfire smoke, unfortunately. And what can they do? When we look at one way that we can measure that is looking at how much Ventolin is getting dispensed by pharmacies, or how many people are seeing doctors related to asthma. And this is just a figure from one study looking at the spike in that during wildfire seasons in 2017 or 18. And we see that it's truly massive, the impact that that's having. 43,000 extra puffers dispensed above and beyond normal, or 10,000 extra doctor's visits. I mean, most people during a wildfire season need to be dragged out of their house. People aren't looking to move around more than they need to. And I think that 10,000 people above and beyond went to their doctors for asthma visits. That's pretty extraordinary. So some of those symptoms, of course, lung irritation, eye irritation, all of these things that unfortunately many of us have probably experienced during wildfire season. These are the common symptoms we want to remind people to look out for. And again, you can take action at those lower level symptoms to try to prevent the more severe manifestations, shortness of breath, chest pain, dizziness, and all of these other symptoms. These are really when we've moved to the point of seeking medical attention. So we want to continue to share that, and we will share this presentation and other resources to understand at what level of symptoms might you take some action to try to limit the effects that might occur, and at what stage do we really need to get to medical help, either an emergency room, urgent care, or other help. And that's one thing that we're really trying to emphasize. But people are more vulnerable than others to heat and to smoke. We can look at this in a few different ways: physiological, due to the actual body, these medical risk factors, but then also socially or environmentally. There's a number of ways that people might be at increased risk due to these hazards. Body temperature is maintained within a pretty narrow range normally, and really we can't have that deviate too far. There's so many different physical processes that rely on that narrow range of temperature. And so once people's temperature deviates from that in a sustained way, really severe outcomes can result. The main way that we cool off is basically evaporation, sweating. We all know that very well. As well, radiating heat directly from the skin is another. Again, we all experience that when have our skin get warm or red. That's the body trying to cool off through blood flow. Many people are less able to do this. Age is one of the things that decreases our ability to cool off. Different medical conditions can do that as well. Having an acute illness or an infection can limit people's ability to cool off. If they have a febrile process, something like an infection that's active, some different medications and drugs can warm the body's temperature or disrupt some of the normal cooling mechanisms. And then just being acclimated to heat, definitely it does make a difference biologically. If one is used to different temperatures, they're able to manage them better or worse. There's a whole variety of drugs, as I mentioned, that can put people at risk for heat-related illness. What I'd recommend is, rather than for most of us trying to memorize or apply this list, recommending that people work with their healthcare providers. That could be a pharmacist, either a physician or nurse practitioner in person. Could be a pharmacist. They can do this over the phone, consulting about are there medications that might put someone at increased risk for heat illness. And that's a good thing to do in the pre-season, particularly for older adults, particularly for people who have multiple medical conditions, to engage in that preparation before and not during a heat wave, to make sure that their medications are optimized. Of course, we're balancing the medical conditions that we need to treat with trying to avoid worsening heat illness, but this is something that a pharmacist, doctor, and nurse can help you with. Social vulnerabilities, as I mentioned, it's not just about the actual the body that someone is working with, but the social and environmental conditions. Having access to air conditioning, most directly, is one of the biggest protective factors. Studies with the city of Vancouver have found that AC, of course, is hugely influential on indoor temperatures, and we're finding more and more that it may be influential on mortality, risk of death during heat waves. Social isolation, barriers to reaching out, so having somebody to check on a person, help them with transportation to a cooling center or just to any other space is very important. And as well as that, we find that often social vulnerability can go hand in hand with people being in neighborhoods where there's also some of these environmental vulnerabilities. Just as an example of this, this is an older book. This is from a heat wave in 1996 in Chicago that over 1,000 people died in. But this particular really tragic excerpt always reminds me of this intersection of vulnerabilities. And without reading it out to you, we see here a situation where somebody had the older age, although not that much older, social vulnerabilities of being in quite a lot of isolation, and an environmental vulnerability. Their apartment was overheated, and so I think really want to keep in mind that sometimes we try to parse out what are the different risk factors, but really often these travel together. And I think that being aware of that helps to identify who might be at most risk in these conversations. So what are these environments that are riskiest? As far as vegetation, things like in this picture where there's very little or no green space, darkly hued roofing and paving materials, absence of cool neighborhood spaces, all of these things can create the urban heat island effect that many of you will have heard of. This is just a figure illustrating that when we look at temperatures, obviously this figure is American because the temperatures are in Fahrenheit, but the general concept is the same, that in these urban areas with all of those features, like more concrete, more paving, less green space, we see higher temperatures. And this is seen really starkly on the left here. We see Central Park right there in the middle of New York City, quite a bit cooler than the surrounding metropolis. And this is also true here in the lower mainland. You see these warmer temperatures across this map of Vancouver. And again, this is an older map, but just demonstrating the concept of how much hotter it can be in urban areas at any given time compared to areas with some of these cooling features. So some of the environments that we're talking about, not at the community level, but moving down to the building level, not having a mechanical cooling or air conditioning, the direction of the windows surface area and the nature of the windows, the single pane windows being a high risk factor. There's a number of different things that can make spaces at higher risk. So it's worth thinking of in terms of the housing that you're working with. Is the building going to be at higher risk? Are there particular units within the building, potentially on one side or the other, or on the highest floor, that might be at increased risk? These are all important factors to consider. There's also happily some things that can be protected from extreme heat. As I mentioned, and I definitely really try to emphasize, air conditioning is an absolutely crucial protective factor. It's not that common in British Columbia, it's increasing, but it's plainly one of the most useful things during an extreme heat event. Vegetation and water features can do a lot to absorb heat and to create cooler spaces, and designing that into buildings in the form of green roofs or reflective roofs can be helpful as well. And this is the same of our pavement surfaces. There's actually some developments that can make these not quite the basking surfaces that we know very well from most asphalt parking lots. Moving from heat into smoke, some of these vulnerabilities are pretty similar. Pre-existing medical conditions like asthma or heart disease are very important. Extremes of age, infants and young children, and also older adults can be at increased risk from wildfire smoke. Also, people who are pregnant can be at increased risk from wildfire smoke too. There's evidence that can be a harm to the person who's pregnant and also to the developing embryo or fetus. And then the exposure as well. So again, it's the person and their sensitivity, and then the exposure that they're subjected to. So someone who's underhoused naturally, who's not able to seek space either due to not having a home or being underhoused, may be at increased risk of exposure to wildfire smoke. And certainly if that home doesn't have ventilation or a system that can clean the air, that increases risk as well. And naturally working or being active outdoors, being unable to seek that sort of shelter at all is going to be important. I really always try during these presentations to consider heat and air quality together, because often heat events and wildfires can happen at the same time. We've seen that in many seasons. And not only can the times overlap, but then the vulnerabilities also overlap. For example, older adults, people with chronic conditions. There's a number of these populations who might be at risk of both of these things at the same time. We sometimes have this competing benefits of, do we want to, for example, open the windows to let cool air in at night, which would be recommended for in an extreme heat event. And we also might want to close the windows to keep out smoke at the same time. So this is a common question and a very important one. We would say overall, most people are going to be at a bigger risk for heat than for smoke, potentially with some exceptions, but as an overall point, this is very sound. So really we would prioritize cooling. Generally speaking, cool, clean indoor air is going to be the goal during heat or wildfire smoke events. But really, I'm putting cool first in that sentence because that's the thing that can be the most the most emergent risk for most people. Moving into the planning side, just before I hand things over to colleagues, there's a number of things that we can all do to plan for heat and smoke responses. First of all, having a plan, having something that's written down, agreed on, understood across a team before and not during these events, really crucial to know who is doing what. Like also knowing which individuals might be susceptible before the hot weather season. Again, these things can happen very fast, so you don't want to be, during a declared heat emergency, trying to figure out who might be at increased risk. Ideally speaking, you might have some sense of that ahead of time. Knowing where cooling centers are or clean air facilities is very important. Being linked to partner organizations in the community. Your regional health authority could be one of those who might be able to provide support during these events. And then having communications planned ahead is really important. The monitoring of environmental conditions, that's part of our job in public health, to push out to the communities when there might be risk, but being aware of air quality events and heat is very important. And that's part of our job to make sure that that information is readily available. And then finally, after an event, looking at what worked and what didn't work, trying to improve the response, which I've worked with many of you on for the next season, is something we can do as well. So many steps that we can take when we're working with individuals or at the level of a given housing situation, whether that's stress. I don't want to necessarily read each of these out because this is information we'll share, but addressing both the person and the space that they're in are really quite crucial. So thinking of what a person's wearing, what mechanisms they're taking in terms of cooling off with wet cloths or other mechanisms, very helpful, but then also the space itself. So intervening at the level of the space with air conditioning, things that we can do with blinds, with movement of air, with fans to cool off the space, all very important, and we want to continue to share about that. NGOs in particular, we get a lot of really good questions on what they can do. People have recognized that their clients, patients, and community members might be at increased risk and asked, what can we do about that? Sharing some of the health communications that are available can be really helpful. This is one thing where we try to distribute, whether it's through social media, traditional media, and other channels as much as we can, but NGOs that are involved on the ground, dealing with people day to day, are really the best conduit for that kind of information. People receiving information from someone they know and trust is really valuable. So disseminating this kind of health information during these events, we believe is going to be a great help. Knowing where cooling centers are, being able to help people get to those, providing transportation or at least letting people know where they are can be helpful. This is information that we're always trying to make it easier to find, but I think again, hearing that from a known source is really important. And then also outreach to people who might be at risk during a heat event, whether that's by phone or in person. We'll be holding webinars with NGOs across the province to give them more information on what does a useful wellness check look like during a heat event. And that's something that checking in on people, making that social connection could be the difference between someone being alone, perhaps not knowing what the next steps might be, unable to recognize the risk or their symptoms, and helping somebody either cool their space off or even seek medical attention if that's necessary. And then finally, many NGOs have actually established cooling spaces and clean air on site. So we have some grants at Vancouver Coastal Health, and there's others available from the City of Vancouver to access portable air conditioning or to take other steps to create cooler spaces. And that's something that a lot of people who might not seek a cooling center might go to a service that they normally go to and spend time there to cool off. So that's a benefit as well, both for the continuity of the services that are being provided and that opportunity to build cooling right into it. These are a few notes around wildfire smoke, a similar format to those that advice around extreme heat. Really, relocation and seeking cool, clean air is the most important thing. I'll just speed right by that because I want to close out soon. The mitigation strategies for wildfire smoke, again, similar in some ways to extreme heat, in that we really want to emphasize that having a device that's able to filter the air, and it's very important. But as well as that, there's things that we can do to avoid incursion of wildfire smoke, and also adaptations we can make to windows and the space to avoid heating of a space. So some of these things might go hand in hand in the advice that we would give. In making this sort of intervention, please consider the Regional Health Authority to be an open door that you can reach to discuss what measures might be most effective for protecting health. This is essentially my last slide. This is just some of the detail on clean air spaces Are there filtration systems in a building? Some of the considerations, really going for the highest rated filter possible is something that we'd recommend. Trying to save recirculation for when air conditions are poor, so bringing less air inside, but then taking the opportunity when if smoke abates and there's cooler air to actually bring in fresh air is something that we'd recommend. And these are all things that, again, the health authority can discuss with you at a facility level if it's helpful. In terms of portable air cleaners, can be great benefit to that. Really important to make sure that they're certified and that they're sized appropriately to the space. You see this example on the right-hand side, that we need filters to be effective for the space that you're trying to apply it to. If they're underpowered, they won't do the trick. And sometimes that can actually lead to problems with power if air conditioners or portable air cleaners are taxed because they're not appropriate to the size of space they're in. So hopefully we've covered this outline reasonably well. I'd love to, if there's any quick questions, I'd love to take them. And then also at the end of the session, maybe after we've heard from the entire panel, we'll be able to address things as a group. There's a few resources in here. Health Canada and BC CDC have both great resources on heat and wildfire smoke. I'd say respectively, those are the ones that we've recommended here, as well as that bch.ca/heat and bch.ca/wildfire smoke should have some useful directions as well. I'd say in particular, BC CDC has a number of great fact sheets on wildfire smoke. The list of them is there on the screen right now, and that's really a go-to source on the topic. So I'll wrap up now. If there's any quick questions, I'll leave it to the organizers to direct the flow of timing, because I could take some now or certainly later in conjunction with the group.
Yeah, so I think I have a little bit of background noise behind me, so I apologize for that. But we have a couple questions in the chat. The first question is there a responsibility or liability for strata managers, landlords, from a basement suite rental, low house rental to a larger multifamily complex to educate residents or address common areas and offer cooling, common amenity room or such? That was from Pat.
Yeah, so at this point, I wouldn't say that there's necessarily any liability, strictly speaking. I would say that, there's recommendations that we would share. So being able to ensure that units are able to reach a cool temperature and have clean air is the ideal situation. We know that the physical plant of many buildings might not allow for that. So this is something part of climate adaptation we'll be working over years to get there. So providing a cooling space, cool clean air in one room of a building is something we definitely would support. Again, I wouldn't say necessarily that there's firm policy that requires that. That's something, over time we might see the municipalities or provincial government update. For the time being, that's something we recommend and really try to support from a health perspective.
Awesome. Another question we have in the chat from Lillian is, what grants are available from Vancouver Coastal Health?
So we have a community fund for a variety of different things right now. And one of the things that we're developing is a community grants program for climate change resilience and adaptation. So that's a new program that we're ramping up right now. And I think that's something, if you were to reach out to the health region, we could discuss some of the possibilities. There's not an open cycle right now, but on an ad hoc basis, there have been some initiatives that have been funded. So that's something we'd like to discuss with you, with our population health team. We're hoping over time to actually have a very similar to some of the food security grants, where we have an annual cycle with many different NGOs engaged with that. We hope to have an ongoing, that kind of support for climate resilience. And again, that could be things like hiring someone to help with climate planning, actually acquiring infrastructure and devices for cooling, and so forth. So that's something we'd like to do. I'd also direct people's attention to the City of Vancouver does have a climate resilient communities grant program. I think that's its name. So if I could pop a link to that in the chat, but that would be obviously Vancouver focused, but that's specific to again, for climate resilience for community-based organizations.
Another question around, how is Vancouver Coastal Health planning for capacity issues in terms of anticipating folks attending hospitals with heat-related illnesses, including also the COVID capacity issues?
Yeah, really wise question. We see that at the downstream end of things, we hope to prevent as many of these hospital visits and severe illness as we can due to extreme heat, due to wildfire smoke. We do know that and from last summer, we still expect to see emergency room visits and even hospitalizations related to that. We've seen that can impact the ambulance system and the hospital system. So right now in Vancouver Coastal Health, and I understand Fraser Health is the same approach, that every clinical program is meant to have a seasonal readiness plan that now would include extreme heat and would include wildfire smoke to be prepared for when a heat event is declared. What are they doing to look at patient flow and staffing and space and all of those issues? Historically, some programs have been doing that very well already. Our long-term care homes have had good heat plans in place that have been quite protective. This is something we're really trying to spread those practices right across the health region to be able to ensure that services can run well during potential surges in demand that we might expect. So I really appreciate that question. That's work that a lot of has happened in the fall, winter, and spring to be prepared for this summer in that way.
And then one last final question. If you could talk about fans, when to use them, how, and then when not to use them.
That's a really good question. And this is one of these the areas in extreme heat preparedness where there actually is some new and emerging science that we're really glad to share. Previously we've said, fans can be helpful to cool off, and we might have heard communicated, I've shared in some sessions that at very high temperatures that we don't necessarily recommend them because it actually create convection and warm people up if the temperatures are in the high 30s or higher. And that is still true. And if anything, the cautions around fan use have expanded a little bit. We wouldn't recommend it as the primary means for cooling a person off during a heat event. Really, the function that they have the greatest use for is for moving cold air. So if there's imbalances in the temperature within a space and there's a cooler area and there's that opportunity to pull cool air from one space to another, that can be really helpful. If, for example, where somebody is sitting is not the coolest area of the apartment and they're not able to move, that's one thing that we would recommend. And oftentimes that might mean that the fan is blowing on a person. However, simply directing it at a person for the purpose of cooling as their main way to cool off wouldn't necessarily recommend. It doesn't seem to actually have that much of an effect in cooling off and can often create that perception of cooler temperatures without lowering the body burden of heat. So this is, again, we're trying to really develop a bit of nuance in our messaging around use of fans. We wouldn't say not to use it, but really just be mindful of how they're being applied, and the resources that you see coming from BCH and from BCCDC will really underline this point to, again, get the benefit out of them without potentially creating a false sense of security.
Awesome. I'm seeing those were all of the questions in the chat box that were included. So I'll pass it over to Jackie. Thank you very much.
Thank you.
Great. Yeah. Thanks so much, Dr. Schwant, for all that critical information and resources. I've been writing down a few things, learning every time. So we're going to shift into hearing from some nonprofit housing and service providers to find out how the extreme temperatures impacted the people with whom they work and what they've done and what they've been doing to respond. So I'd like to introduce Luann Ruotsalainen from DeKalb and Quesnel Community Housing Society.
Thanks, Jackie. Like Jackie said, my name is Luann Ruotsalainen. I am the Executive Director for DeKalb and Quesnel Community Housing. I'd like to first acknowledge that I do live and work and play on the unceded traditional territory of Latako Dene peoples, which is also home to our Inuit and Métis families as well. So I'd like to acknowledge that. DeKalb and Quesnel Community Housing Society, we have several programs that we do run. As you can see, we have 33 housing units under our Urban Native program. We have 31 housing units under our BC Homes Affordable program, 28 housing units under our Rural Native and Housing program, 38 housing units in our downtown core, which is a mix for our families and our elders and our youth. We also operate and manage Silver Manor. It is for our seniors in our community. And we also have one unit that we use for our homeless at risk for our Aboriginal youth to give them 24-hour supports to keep them off the streets. If you could go to the next slide, please. So some of the things that we have done to try to respond to the extreme heat and the fires that we've been going through is our society purchased a lot of air conditioning units to try and help our tenants. We applied for funding from AMA to get some of these units, but we also, as a society, purchased many air conditioning units for our tenants because our temperatures, as was brought out, were in the high 40s. So we were ranging, which we're not used to in the Quesnel area for the last few years. It's been averaging about 42 degrees. So what we did is we got, again, as many air conditioner units as we could through applying for funding. But then if we couldn't get the funding, then our society would buy them. If our tenants couldn't pay for them, then we would just pay for them ourselves. We also set up as many cooling stations as we could for our buildings that did have air conditioning units in the common areas. So we made sure those were available 24/7, that tenants could come and go freely as they wished. If they had extended family that didn't have air conditioning units in their own homes, they were welcome to come and enjoy that as well. We applied for gift cards from from AMA, and we also used some of the society's funds that we have to get groceries for our families, and made arrangements that we would get them delivered to them, or if they could not, then we would go get the groceries for them and deliver to the homes, especially for our elders and our seniors. We did regular checks on our elders and our vulnerable tenants. So what that involved was that when it was really bad for a few weeks there, every 2 hours we were checking on our elders and our seniors, and again, our vulnerable. So we would physically go to their units, knock on their doors, make sure they are okay. If they needed anything, that we would have it. We had a little tote with us, or a cart, that would have cold water in it, any electrolytes, cooling cloths or ice packs that we would give to them to make sure that they were doing okay. We would do a quick health check with them just to make sure that everything was going okay. If they needed anything, that we were there, try and give them some advice to try and stay cool, make sure their air conditioners were working properly if they had them, or their fans. Next slide, please. Some of the things that we are testing out ourselves, especially for our buildings that don't have air conditioners, is that we're looking at swamp coolers, because those are very helpful, but just making sure that we would have proper airflow for the units, wouldn't cause a moisture in our buildings. And our maintenance ensures with our air conditioning units that they're checked annually, but when they're used so much, we are checking them constantly just to make sure they're running effectively every day. So twice a day to 3 times a day, they make sure they go to the common rooms, make sure they're running properly, they're not plugging up, making sure that everything is clean, and then setting them up and making sure the tenants again are okay. In our common rooms, I forgot to mention, sorry, before, what we'd also do is we'd fill the fridges with water and electrolytes, so that tenants could freely grab those as they needed, and made sure that that was always in those fridges. We put popsicles, whatever we could, to try and keep tenants cool. And we have a great bunch of tenants, because they also offered to help to keep an eye on some of our vulnerable tenants that, after we're closed, that they would literally take a shift and say, hey, I will do my checks for you as well, to make sure we were available 24/7 for tenants. If they needed us, they just had to call our office, and we would be on call, would get a call, and we'd go take care of whatever was needed for our tenants. Next slide, please. So for us, we're trying to be as prepared as we can. So we have learned a lot over the last couple of years. So already we've purchased spare air conditioners. So I purchased those last year, and they just came in last week. So we purchased quite a few of those, because there's still quite a few of our tenants who do not have air conditioners or fans. So we bought that. So we're prepared. We were buying cases and cases of water, electrolytes, everything that we can. We have our checklists ready of who we know who needs the most attention, from the feedback from our tenants that we have been checking on, but also from our tenants. Our staff, we all chip in, maintenance and everybody, to helping get our tenants to get their air conditioners reinstalled, make sure they're serviced, make sure all the filters are clean, that there's no mold buildup or anything like that, get them all cleaned up for them. And make sure, again, in the common rooms, that we service them yearly, but when it's been this hot, we usually do it 2 to 3 times just to make sure everything is really good and that there's no other outstanding issues that will cause a problem for our tenants. We've also encouraged a lot of our tenants to get lined curtains, because we have the blinds for tenants, but the lined curtains really help with the heat. And a lot of our tenants, we've been supplying standing fans or ceiling fans in their homes to help circulate that cool air once they have their air conditioners going, or if they don't have an air conditioner, as was mentioned in the previous, to try and get the cool air going for them, for our tenants. So we're just trying to learn from those things and keep these things in mind. And we've also asked a lot of our tenants what worked and what didn't work for them. And so now we're working on those things. If they needed more checks, did they need more help setting things up? Did they need us to contact family to make sure everything was okay? And if we saw an issue, what we could do to try and help them, or contact the family to make sure that they knew that they needed help, because we can't do everything, but we can sure try and help them the best we can. So that's what we've done, and the lessons we've learned is the biggest thing is being prepared and talk to your tenants, see what they need, try and help the best you can. So there, that's mine.
Great. Thanks so much, Luann. And next, I want to pass it on to Patty, and I'll just reshare my screen here.
Guess it'd help if I unmuted. Anyway, well, thank you very much for the opportunity to speak today. And I'd like to acknowledge that I'm coming to you today from the unceded territory of the Stalo peoples. And I've worked in the conservation sector as well as in the anti-violence and domestic violence sector. So where we're at right now, I think is we're in a collision with climate change, severe events, with people and planet. And I think that I'm here today, as many are, to give a voice to a lot of the people that we serve that maybe do not have a voice and that are who most greatly impacted by some of these events. So that's why I'm here today. I want to go to the next slide. So for 41 years, Ann Davis Transition Society, I've been here, I'm in my 10th year. Ann Davis Transition Society has provided housing, transitional housing for women. And we've evolved over the years, and we provide holistic services for all ages and all genders, which includes counseling, outreach, legal advocacy. So quite a range of service. To give some context, in 2021, we provided over 8,000 bed stays for women and children. The need for affordable housing, we all know it's on the incline. We have the dubious distinction of having one of the highest ratios of homeless women in the province, with 43% of our homeless population being women. And during the pandemic, our crisis calls went up 43.7% in November, and they just haven't gone down. Our numbers have just kept going. And the numbers of senior women seeking help has also been rising exponentially each year. And recently, we had 1 week, 80% of our residents in our low barrier 22-bed house were over 50. Next slide, please. So Fraser Health Authority, some of the stats are that 52% of the deaths were due to the heat dome, equaled out to, or the Fraser Health Authority, and Chilliwack is part of that, where I'm from, is 273 persons, and 79% were 65 or over, and 51% were women. And I think the numbers, as one of the previous presenters were saying, they're still kind of in fluctuation. So in Chilliwack, of 22 deaths, 15 were women. And Chilliwack was the 6th highest township in BC reporting heat stroke events. Thank you. Next slide. I'm going to read this. I think something that in our sector and that people may not think of, and I think that is really important to bring forward, that women experiencing poverty and women experiencing domestic violence are at higher risk in severe climate events. So women living with the daily disaster of domestic violence are highly vulnerable when disasters transform geographies, institutions, and relationships. In the vicious dynamic, I'm just going to read this, power and control. Women who experience violence live in a world of increasingly narrow social networks. So often they're isolated, they're unable to take or keep paid work, they're lacking transportation, and oftentimes they're financially dependent, and that is part of the abuse cycle. Organizational responses, and I wanted to talk about not just the heat dome for us out here, and I think is because these are cumulative kinds of things that we're dealing with. So there's the heat dome, we had the recent flooding, and then overarching is the pandemic. So for domestic violence and disaster impacted, our responses really matter. They really matter. So the daily realities of living with violence make attending to the threat of disaster unlikely, and stabilizing life in a disaster-stricken neighborhood and community it's very difficult. So what happens when women are already in emotional crisis, are they're at risk of violence or they're experiencing violence, they're focused on the relationship they have just left, or they're just trying to survive day to day in the present danger of their lives. So they often lack the ability to have a strong sense of awareness of what's going around them. And we all know from what we've been seeing is that crisis happens very quickly and it demands a quick response to stay safe. Thank you. Next slide. So severe weather events like mudslides, heat events, or flooding often isolate women at home in unsafe environments without working telephones or accessible roads, and contact with crisis counselors may be cut off, court-ordered protection unavailable when major disasters disrupt or destroy lifeline services, including law enforcement agencies. Older women with limited income are also more at risk, as we have tragically seen with the heat dome, with an unconscionably high number of women dying alone in their homes due to a lack of being able to keep cool and experiencing life-threatening heat stroke. Thank you. So something that came to our attention as well was the plight of women farm workers in our community. So I had a call, and on June 28th, where 55 migrant women were being moved out of the heat into a refrigerated workspace, but they did not have clothing to be in that. So we went, our outreach team went, and we provided clothing for those women. And then we found another over 50 that needed clothing to combat and resources to combat the heat. So we were able to provide each woman with weather appropriate clothing, hats, hygiene products, and grocery cards, and develop relationships so that we have, and these were Spanish speaking workers from Mexico. Next slide, please. So we also do outreach. We have a very busy outreach office. I just, our daily count for March, we served just over 2,000 people. So that sort of puts it in context. I think, you know, in the valley out here, we're not as in the public eye as maybe the Vancouver East Side, but we really do have some people needing help and a lot of vulnerable people out here. So from June 28th to July 2nd, we went out in the community to attempt to provide some relief and necessary items to our most vulnerable. We gave out 303 care kits. We gave out water, clothing, sunscreen, and resourced accommodations. We provided service to over 1,000 persons in that window. Like many communities, we have homeless camps, and one of them is Chilliwack's Island 22. And a lot of vulnerable, street entrenched, and more displaced seniors are calling these camps home. They set up temporary shelters with tents, wood pallets, or small trailers. And during the heat dome event, we went out and we gave out 42 care kits, but we also gave out other resources and provided sources for them. I'm just looking. So I just want to take a minute. So what we saw during this time, the most impacted that we worked with are women who were experiencing domestic violence, seniors living with limited income, not and I think it's talked about in the first slide and then in the second one but they did not have proper air conditioning or ways to keep cool. And then migrant farm workers and persons who live unsheltered. And, you know, it happened so quickly. It just was it was a bit of a disaster. It was really, really hard to deal with. So, but we did the best we could. So next slide, please. Thank you. So much of the help we were able to give to our community was because of supporters. So social media, we were able to let people know what we were doing, get the message out, who we were serving. We asked community members to contact seniors they knew who may be at risk to do check-ins. We also had our crisis intervention workers phoning seniors, phoning past residents, trying to check in. But it really was like, it really was hard because it was just so, people were in such dire circumstances from this. So, so the challenges were getting to people the help in a most timely manner. What worked well for us was collaborating with others. Lessons learned is we needed to be prepared, and we need to work upstream of events. And we've been working with the city and others to do that out here. We need to have the capacity to have cooling centers and emergency centers, and we need to have them ready to go with 24 to 48 hours, because that's what's needed in these kinds of situations. There needs to have numerous communication venues besides social media, just radio, TV, old-fashioned call trees with persons at risk identified ahead of time. And we believe that all levels of government plus key stakeholders doing the work need to be at the decision-making tables to ensure that workable plans are effective and really meet the needs of the people that are more at risk. Next slide, please. So I just had a couple of testimonials. So we have some green space. We're lucky, but a lot of people, a lot of heat stroke. We have a lot of unhoused persons in our community. So they were finding bits of shade in some of the parks. They were needing water and protective clothing, but it was a very urgent situation. The next one I'm going to talk about, and this is something that made me cry, and it still makes me feel emotional. And because this is really what happened is, like, one man sitting in the grass off the overpass, and he was crying. He literally, his his shoes had melted off his feet, and he couldn't go anywhere. And we were able to provide him with a real pair of sandals. But I mean, I cried going home that night. I mean, we were working with people. It was all hands on deck. I know I'm the executive director, but we were all doing what we could. A lot of people, to me, it looked like they had been in an atomic blast. They were so burnt, and we need to do better. And I think that, you know, I'm so heartened to see that people are coming together, and to see that the Fraser Valley and our community is included this time into having to bring the voice of what's happening for people out here, because it's really, we really need to work upstream here. Some of the good things that happened is developing relationships with people that we may not have otherwise reached. So we had one person that was very surprised. They were hidden between a couple shopping carts with an umbrella, and they were able to share their story, which was pretty tragic. But we've developed the relationship, the outreach team, and finally able to get them into subsidized housing. Life-changing. The person's doing very, very well. So that was really, just to end on a good note, something good that did come out of that. But I think we can do better. We need to do better. Anyway, next slide, please. And thank you very much. That's it for me.
Thank you so much. That story gets me every time. I really appreciate you taking the time to share. Next, we have Marty Jones from Surrey Urban Mission.
Good afternoon, everyone. Thank you for this opportunity to join you and to take part in this. Thank you to Luann and Patty and Dr. Schwant for some great information that I hope we can all apply as as the weather begins to change. I'd also like to acknowledge I am coming to you from Treaty 6 territory, the traditional and ancestral territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux people. I'm on a bit of a vacation right now in Edmonton, Alberta, but I did not want to miss this opportunity to be with you folks. So thanks for having me and thanks for accommodating me from a distance here. So as was mentioned, I am from Surrey Urban Mission Society. We are based primarily in the Whalley area of Surrey. We operate 4 shelters in that area, which provide safety and rest for over 200 people every night. We also participate in EWR during the winter, which this year we were really excited. We were able to provide 30 sleeps each night for 30 additional people. So that was wonderful to provide that opportunity this year. We also provide food services in that area to our shelters, as well as people who on the street who come to our one location and they're accommodated there. We provide clothing and essentials at every shelter for our guests and those in need in our community. And one of the things that is really tied to the extreme heat and how we participate in caring for our community that way, we run something called Community Connections Worker. And this program assists guests and general public with resources, referrals, and connections to local, provincial, and federal agencies and ministries. Next slide, please. Well, 2021 was our first endeavor into helping people in more specific ways other than just handing out a glass of water or a bottled water in the past. So this past year, each shelter responded with bottled water and water in a cup. Nobody was turned away. Whether somebody just came up to our front door of one of our shelters, we would accommodate them with something cool to drink. Each shelter also had sprinklers or hoses that were available to the guests. And something that we were really excited to provide at our emergency response center, which is the old North Surrey Rec Center, and our Olive Branch location, is we actually had cooling tents. And these cooling tents were just a basic mist that would descend on our guests as they would get hot. They would just, or heated it up, they would walk under there. And the other thing that was really neat about this is we were able to actually provide this to our community. The ERC is located right in a major bus loop, one of the main transit areas of Surrey. And so there would be hundreds of people each day that would be coming under there and just getting a little bit of a cool off and then carrying on with their day. With our CCW program, the CCWs provided water. They would head out with backpacks, and then they would also have maps to direct to cooling centers. The city of Surrey was very involved in trying to accommodate those who were suffering from the heat. And then if our connections worker found someone who did have heat exhaustion or heat stroke or were just not doing well, they would call either the non-emergency RCMP or they would call the BC ambulance for extreme cases where we could get them the proper care that they needed. For 2022, feel like we've learned a lot of lessons. I do need to thank the people who we were involved with last year. We had a great response from the city of Surrey, also from BC Housing. And then we also worked with HSABC. Chloe, I think I saw you on here. Thank you for the partnership with these agencies. They were wonderful to work with. And so this year we do want to expand the number of cooling tents. We want to make sure that we have these at each one of our sites, and then working more with the city as well, seeing what we can do to just provide better care for our city guests. We want to extend the hours and the area that our CCW team would work in. It was primarily, if you know the Whalley area, we were primarily between 104 or 101 and 108. And we would love to just try and find some of the other encampments in different areas, work with our bylaw agencies in our city to make sure that we're caring for people. And then we want to get the word out in advance into our community. That takes me to the last slide. And that's, we want to provide opportunities for our community to get involved. We're finding that because of COVID, people want to, they've been out of the loop, so to speak, with providing and donating and volunteering, because so many agencies and ministries like ourselves, we just didn't have people in our shelters or different areas of our ministry and agency being able to volunteer. So we want to provide ways that people can do that. And so over the next few months, we'll be ordering supplies. We'll be looking at ways that we can begin to do some drives or campaigns for hats and sunscreen and bottled water, energy drinks, anything that can provide some relief for the heat. I do have one last slide with my email. If you're interested in any of the cooling tents and some of the things that we did to connect to tents, there was places that we ordered the cooling systems from. They're very simple to set up and they just worked really well. And we found them to be very successful. So thank you for having me. I appreciate it. Thanks for this opportunity.
Thank you so much, Marty, for taking the time, and I hope everything's going well on your trip in Edmonton. Thank you also to Luann and Patty for sharing what it's been like to respond to these issues on the ground. Switching gears one more time, I'd like to introduce you to Magda Spala, Director of Sustainability and Resilience at BC Housing. Magda and her team have been hard at work coordinating resources for nonprofit housing providers, and she's here to share some of that information.
Yeah, thank you so much, Jackie. And I just would like to start with acknowledging that at BC Housing, we conduct our activities on the ancestral homelands of hundreds of Indigenous peoples and nations across BC, each with their own unique traditions, culture, worldviews, languages, and history. And at this location, I am on the traditional and ancestral and unceded homelands of Musqueam, Squamish, and Tsleil-Waututh nations, who have been the caretakers of these lands for thousands of years. And I'd like to pay my respect to their peoples past, present, and future. So I'm here in a bit of a dual role. So as many of you know, BC Housing has our own portfolio of buildings that we own and manage. And we also have a role in terms of our partnerships with a lot of nonprofit housing and shelter providers. And so what I'd like to cover in the next few minutes is just to share with you some of the things that we have done as a housing provider, and similar to the previous presentations, but also point you to some of the resources that we develop, hoping that they might be helpful for other organizations. We actually recently, through BCPHA, there was a survey. Some of you may have answered that survey or responded to that survey, asking questions about extreme heat and the level of preparedness. And we got 150 responses. So thank you so much to everyone who responded to that survey. And some of the key information we got from that was a bit of a bad news and good news. So bad news was that 40% of respondents indicated that they don't have any heat preparedness plans. So that's a pretty high number, and we're hoping to reduce it. And the good news is that 60% of those that do have plans said that they'll be happy over it, that they would consider sharing their practices with others. So we're actually hoping to facilitate more of this information sharing among the nonprofit housing providers so that we can learn from one another. So just similar to other presentations, you know, we kind of followed. You can see there's a bit of a pattern, and but I think there's worth in sort of repeating. So we start our preparation way before the summer. If you remember the last few years, we actually had first heat waves in May, 3 years ago, and before. And so we start our preparation in about April. And we start with providing education and training for our staff so that they know how to recognize heat-related illnesses, what are the risk factors that Dr. Schwandt presented earlier, how to identify, you know, who is most at risk. And I'll talk about that a little bit more in a minute. And also what to do. So kind of what are the different roles and responsibilities within our teams related to responding to extreme heat, and I'll cover that in a minute. And so starting with the staff awareness, we're looking at risk related to the individual themselves in terms of the risk factors, as well as the building and any additional information we may have. We also communicate what to do, who to contact, how to stay informed. And we have a lot of this information available on our website that I will share with you in a moment. Moving to the next slide. So there's a few points that everyone needs to remember. So we've created a number of different checklists. So this is a checklist that we use to remind us what are the things that we want to do before the summer. And those checklists are again available on our website. So I'm hoping that you know, the organizations that don't have a plan may want to grab one and adjust and make it your own. We found it quite helpful just to make sure that we're covering all the different steps. I'm not going to go through the details, but I include things like, you know, are you aware of the symptoms? Is there opportunity in your building to create a cool space? Do you have all that you need in terms of creation of that cooling space? Moving to the next slide. And in addition to the checklist, we also have things like, you know, you may have a big room and it may not be obvious what kind of options are in terms of different sizes of AC units and so on. So there's a lot of resources on how to create a cooling space, how to calculate what sort of AC unit you may need. And really want to encourage everyone, if you haven't purchased those items yet in terms of cooling items such as fans or AC units or air purifiers, now might be a good time to do it as soon as possible, because we found in the last few years that in the summer it's actually very hard to get hold of those items. And if you have financial challenges to purchase those items, please contact your portfolio manager and discuss that with them. There's definitely, after last year, an increased awareness of how important, how crucial it is that we are all as prepared as we can be. The next slide. So another tool that we use, so we in situation where the extreme heat or dangerous heat is called by public health, we initiate individual wellness checks with our tenants. And because we have a lot of our buildings are quite large, we need to keep track. And so we developed this checklist that allows us to keep track on who's been contacted, when, what was the outcome of the wellness check, and then we enter into our system, and it allows us for different staff to know what's been done prior, what requires follow-up, and so on. So again, this is just an example of a tool that we use to keep track when we activate the wellness checks for our tenants. And it's also available on our website as a template. We have updated some of our communication materials. So what you see on this slide is updated poster, tips to beat the heat. It's just been freshly uploaded on our website. So again, it is available for download and printout. So on the left is the poster. And then we also found where we do the wellness check, sometimes people are not there, but we want to leave something so that when the tenant comes back, they can see that there is a visit. And also to kind of remind them what to do. So we also created those tenant response cards. So they are smaller size that contain just key messages and also some visuals. And they are also translated in 13 different languages, and they are available on our updated website. Moving to the next slide. So this is on the right, you see a screenshot from our website. There's a lot of materials there. We will be updating some of the materials and so you may see some of the changes on the website, but it is already available for your use. So it includes a lot of different, it includes a guide and a template on how to create an extreme heat response protocol if you don't have one yet for your organization. What are the heat-related illnesses, symptoms, and what to do. There are some specific materials that you can use directly for communicating with your tenants, including how to protect pets. where to go for information about possible extreme heat and wildfire smoke alerts. And there's also other resources specific to building design and building upgrades, how to consider the risk of overheating if you're in the process of constructing a new building. So really encourage you to use the website and also provide any feedback or any information that you see that might be missing. We try to create as much resources as possible and try and be helpful. And I think that's, oh yeah, and just if, so part of our wanting to collaborate and share and support nonprofits in development of your own heat response plans, we will be offering extreme heat and wildfire smoke workshops. We will also have medical health officers, just like Michael, Dr. Schwant here at this session for all those three. So the first session is in Nanaimo on May 9th, and then in New Westminster and in Prince George. And they are meant as workshops, so we're hoping that at the end of that short session, but people who don't have extreme heat response plans will work out at least with good idea of what they need to have in place to create one. So hope that you'll join us for those sessions. And that's it. And very happy to hear from anyone after the session with any comments or questions related to extreme heat. I am coordinating a lot of different aspects of this work within BC Housing, so I'd love to hear from you. Thank you.
Great. Thank you so much, Magda. We have time for questions. What do we got, Courtney?
We have two currently. Let me just pull them up here. So the first question was for Luann, but anyone from the panel is probably able to answer. Does your organization have a formal heat emergency preparedness plan outlining the steps, protocols, and actions that your organization has taken on a hot summer day that you just presented to us?
So yes, our organization, I think that was from Alice Street, had asked that. So what we do is very similar to what BC Housing has set out. And we've actually added it to our calendars. So we know that when the heat wave starts, these are the steps we need to start taking and be prepared for. And then we also have a list of our tenants that we know that are going to need more of our attention than maybe some other ones. So we make sure that we put that in our calendar, and it just is always there, and it wraps every year. So we kind of know when the heat waves will start. So we can just make sure we make a reminder for ourselves to make sure that hopefully everybody is taken care of the best we can.
Awesome, thanks. Another question that we had is, can someone speak to the importance of differentiating between a hot summer 29 degrees-ish Celsius day and an extreme heat wave or dome, and then preparing for an extreme heat as well as just a typical hot summer?
Yeah, I can definitely speak to that. This two-stage heat alert system that we've been developing in BC, and this is something that was activated, the second stage was activated for the first time last summer. It's really aiming to do that, to recognize that there's definitely the level of what we'd call, very hot days, even a heat wave, where we might see an increased risk of heat illness, and it's definitely worthwhile to activate some of these processes that we're describing. And then there's also days that are above and beyond that. So the thing that we might expect to see once or twice in a decade, where we know from previous evidence that we expect to see increased mortality without very substantial intervention like we're discussing today. So I think you'll increasingly see when we have alerts discussed in the media, messages coming from the health authority, a clear differentiation of those levels. Some of the feedback that we've got is that when we're sending a heat alert, we need to remind people and be very clear, because this isn't necessarily widely known, what the two levels are and which one we're at currently, so that people can adjust accordingly. So that's something that feedback that we've taken as a health authority, and we want to make that clear in those declarations, because there definitely is an above and beyond aspect to when we get to temperatures that are sustained into in the 30s, for example, in the Vancouver area. We would see that declared. So please do look for communications from your regional health authority around that with those escalating interventions.
If I could just add to that, for us in the north, because we're not used to the heat, anything above 25, we are finding for our tenants and for ourselves anyways, that anything above that, once it starts creeping up there and into the 30s, that's when we're having a lot of our tenants are having especially our elders, are having a problem. And so that's when we start to react. Anything over 25, we have our plan in place. Again, just because we know our tenants, which ones we need to help at that time. And then once it starts hitting the 30s, then we know who else, what other second stage for us we have to do. But we just find it a little bit different for us here, that we just instate it, put it into action quicker than before it hits the 30s.
Awesome, thank you. Another question from Chloe in the chat. Would Vancouver Coastal Health recommend communities mobilize resources for unsheltered individuals at the warning criteria as opposed to just at the escalated alert criteria?
Yeah, that's a really good question. We would see there a likely gradient being appropriate in those circumstances, and we're trying to work with on a municipality by municipality basis or with separate organizations on what those specific interventions might be at one level and what would be the interventions at the next. Because of course we understand that a full out response, doing all of these things that we might at the level 2 response might not be possible or even appropriate at that first level of heat notification. So we want to work with people who are involved in that planning to set that kind of ascending hierarchy. We would definitely advise that check-ins or outreach to people who are the most vulnerable could be beneficial even at that level 1. One, some of the most vulnerable might be at increased health risk, and 2, it's a good chance to activate and test out those response pathways, because if the temperature does escalate, or if that's maybe it's the first heat event of the summer, there is an opportunity to check in with people, ensure that they have a plan, that they have a heat buddy or another other supports in place. So we probably advise a partial but not full response at the first level.
Awesome, thank you. And then I have a question from Rosemary. Many of BC Housing clients, especially seniors, are on SAFER, an acronym SAFER, in market rent. What is being done to help them and to access air conditioning or other resources?
Yeah, thank you for that question, and thank you, Jackie, for responding on our behalf too. So, Jackie talked about BC and PHA, but it's similar to BC Housing in terms of our mandate. It is to support the affordable housing providers, and in terms of responsibility for health and safety of tenants, it does belong to a landlord of any given or operator of any given building. So our role is to support those landlords, and BC Housing does have a mandate to provide research and education to the construction industry. So we are working with them in terms of providing training and different guidelines on how to address the risk of overheating in new buildings and major upgrades. But we're not working directly with SAFER clients related to extreme heat, but it is kind of a good issue to raise. So thank you for bringing it up.
And then the last question I'm seeing in the chat is from Patrick. Can anyone speak to portable air conditioners versus window units? Is that what we're seeing being purchased moving forward?
Yeah, maybe Luan, go ahead.
Oh, I was just going to say, for our society, because of the windows that we have been doing the portable ones. And then what we get is like Lexan put in there so that hoses can still fit in the window, still stay secure. And they're a lot easier for the tenants. The window ones we can't use anymore because because the windows that are being installed, they won't work. So all of ours have been the portable.
Yeah, and I want to say from BC Housing perspective, we're actually not allowing in our buildings the window units. I'm not sure if people are aware, but there's been a fatal accident in Toronto when one of those units fell out of a tower and killed a child. And so there's various risks related to that, and then depending on the window. So we are actually yeah, we're not allowing the window shakers in our units. We are using the portable AC units, and also always looking at opportunity to install heat pumps when possible, you know, even just for the cooling area. Jackie, I wonder if you may have some other comments on that one.
No, well, I guess I could give a plug to our energy team. So I mentioned in the chat that in terms of incentives that are out there, if your buildings are townhouses, single family homes or row houses, there is utility rebate incentives. And for any multi-unit residential that are going to electrify, there is funding from the province, from Clean BC. So I can put our email address, but energy@bcmpha.ca, and we can answer questions, all of your heat pump questions, or as many as we can.
Great. I'm not seeing any more questions pop up in the chat, but if folks are comfortable unmuting, we also have a couple of minutes. I'm not always confident of the time. I always have 3 different clocks in front of me. Living life on the wild side. All right, not seeing any more questions pop through, so I will pass back over to Jackie.
Thanks so much. Thanks for your questions, everyone. And yeah, I really want to thank our presenters, Luann, Patty, Marty, Magda, Michael, Dr. Schwant, for sharing your very valuable time, your knowledge, expertise, your experience on the extreme heat response. I'm sure a lot of people got some good information today. And as Magda has mentioned, if you or your staff want to take part in a workshop to develop or improve your extreme heat plan, I encourage you to sign up for one of our regional educational network and trade events happening in Nanaimo and the Lower Mainland next month, and yes, and in George in June, and in Cranbrook in September. So this concludes our presentation. Thank you all for attending. Oh, how about an evaluation?
Oh, 2 things. Apparently I missed a question in the
sure.
chat that folks are wanting to answer. Sorry, I read it as just a blurb, not as a question, but my mistake. So from Christy, as city staff, we are in the process of creating an extreme weather strategy, and there are discussions around what temperatures we respond at. However, we need a stable source, i.e. Environment Canada, to help us call a response. Environment Canada's definition of a heat wave tends to be a lower threshold, which then has implications on resources and service agencies. Our first priority is the health, of course, but it can be hard on operators if they are open for longer time periods than we're used to.
Okay, that's an interesting point.
So I wonder if Dr. Schwant could comment on the thresholds and what's used as trigger for activating the heat alerts.
Oh, in terms of the degrees themselves?
I think just general comment. So I understand that the comment here is that the Environment Canada, you know, just how the alert system is kind of works.
Oh yeah, absolutely. Glad to talk about that. So these really flow quite directly from the temperatures on a given day and the forecast temperature the next day. So what we look at, or Environment Canada, I should say, there are experts in the weather, naturally enough, are looking at the sequence of things. Like what's the temperature today, you know, at the hottest point, which we could say as of 2:30, we'll usually know. The overnight low and the high the next day is what they're looking at. And so, for example, in the southwest area of British Columbia, if it's over 29 degrees today, it's not going to go below 16 tonight, and 29 or plus is forecast the next day, that would be the level 1 heat alert. And this differs from region to region because, as I mentioned, acclimatization could be important, and we see different risks depending what the normal temperatures are. That would reach the level 1 declaration. And it's really just based on, again, today's temperature, tomorrow's forecast in a very direct way. Now, level 2 is those criteria with the expectation that the temperatures are going to increase day on day. So we might see a single day like that reaches the level 1 criteria. If we expect that this is going to continue to increase, and other considerations from public health, if it's the first heat event of the summer, which we know can be at higher risk when people aren't acclimated, they're not, and some of these processes aren't as activated, those are the times when we would move to that level 2 forecast. So it's those temperatures plus those additional considerations. Really, one of the things that Environment Canada would look at is, are we looking at 3 days or more of temperatures like that would likely lead to a level 2 declaration.
Okay. Thank you so much for the question, Christy. Thanks for clarifying, Dr. Schwant. And that concludes our webinar. I hope you all have a fantastic rest of your day. Take care. Be well. Bye-bye.